Here it is the anterior compartment of thigh muscle. Okay, let's go to this. Okay, this gut muscle, this one is gut muscle. This one is known as sartorius. As you all know, sartorius is the longest muscle, which is about 45 centimeter, arises from the anterior superior iliac spine. Here I mention that is the anterior superior iliac spine. Here it is the gut muscle. Okay, it is gut, anterior superior iliac spine. Here arises, here from here arises of sartorius muscle is happen. Okay, then we can go to this is the this one is known as rectus femoris muscle. Rectus femoris, we all know about rectus femoris. Rectus femoris has two head, that is one straight head and one is reflected head. The straight head is arises from anterior iliac inferior iliac spine of hip bone, and the reflected head arises from the superior aspect of acetabular fossa. Okay, so this is rectus femoris, and this one is as it is present on lateral aspect, that is known as vastus lateralis, and this one is vastus medialis, and this is the thickest tendon. This is the thickest tendon. Okay, that is about quadriceps femoris. The quadriceps femoris tendon is attached to the patella, and this one is known as patellar ligament, which is attached to the tibial tuberosity. This one is tibial tuberosity, this one is tibial tuberosity of tibia, from where the sign of tibia is arises, that is from the patellar ligament is attached to the tibial tuberosity, and here it is a muscle that is known as vastus intermedius, as it is closely attached to the bone shaft of the femur. Okay, so we can quickly summarize it and the nerve supply and the function. So let's begin. So here there is sartorius. Okay, we can highlight it. This one is sartorius. This one is sartorius muscle. The sartorius muscle, which is the longest muscle, and it is arises from the anterior superior iliac spine, and which is and inserted in the medial aspect of upper part of tibia. Okay, that is here, it is the longest muscle of the body. Okay, and it is also known as Taylor's muscle. It is also known as Taylor's muscle. Taylor's muscle. Okay, so next one is, this is rectus femoris. This is rectus femoris. That have two head. One is straight head and the reflected head. The straight head is arises from the anterior and inferior iliac spine. That is here. that is here, that is here, that is here. Anterior inferior iliac spine. Anterior from anterior inferior iliac spine, the straight head of rectus femoris is arises, and the reflected head is arises from the superior aspect of acetabular fossa. That is from here. That is from here. That is from here. Here it is anterior inferior, and this one is from reflected head. Okay, so the rectus femoris muscle is supplied by femoral nerve. Femoral nerve. We can clearly say that the anterior compartment of thigh muscle is all supplied by femoral nerve. Okay, so we can highlight this. We can highlight this. This one is rectus femoris muscle. Rectus femoris. Though it has two head, here it is one head, here it is one head. Okay. Let's next go to the sartorius muscle is also supplied by femoral nerve. Femoral nerve. As you all know, femoral nerve is the largest branch of lumbar plexus. L2, L3, L4. Okay, and the vastus group of muscle and the vastus medialis, vastus lateralis, and the vastus intermedius all are supplied by femoral nerve. That was L2, L3, L4. That is here, here. I am numbering it. Here, all are supplied by femoral nerve. The quadriceps femoris is also supplied by femoral nerve, and it is all about the anterior compartment of muscle of thigh. And we can yes, this one is the strengthen the hip bone. That is the longest and the strongest tendon of body, strongest tendon or ligament. Okay, ligament, strongest ligament of the body, that is known as iliofemoral ligament, or it is also known as ligament of Bigelow. That is Y-shaped, English alphabet Y-shaped. Okay, so we can go to the lateral compartment of muscle of thigh. Before going to the lateral compartment muscle, I can mention about the function of this group of muscle. So this sartorius mainly function as flex. Here I mention flexes thigh, and the all flexes thigh. The rectus femoris muscle also flexes the thigh, and the vastus lateralis muscle which extend the thigh. All the flexor, all the extensor are at the level of hip joint. Okay, so The vastus medialis and the vastus lateralis, also vastus intermedius, also helps in helps in extend thigh. So we can quickly summarize it that the three vasti group of muscle, that is vastus medialis, vastus lateralis and the vastus intermedius, all are extend the thigh, and the rectus femoris is flexor the thigh, and the sartorius which is also known as talus muscle, that is also flexes the thigh, which is also the longest muscle, and the strongest muscle of the body, strongest ligament of the body, that is known as iliofemoral ligament or ligament of big toe, that is about Y-shaped. Then we can go to about the lateral compartment. As you see, this is the medial compartment of thigh, and the medial compartment thigh has a bunch group of muscle, and we can read about the function, the nerve supply, and the attachment of this group of muscle. Okay, let's begin. So this one is obturator externus, as it is arises from the external surface of the obturator foramen, so it is known as obturator externus. And this one is adductor magnus, as it adduct the thigh at the hip joint. Adductor magnus has two head. That one head is both are arises from the ischial tuberosity, and here it is the ischial tuberosity. Okay, so adductor magnus has two head, that is one is hamstring muscle, one is from hamstring group of muscle, and another one is straight head. That adductor magnus has two head. Okay, so let's go to the next muscle, that is known as pectineus. And pectineus, as I clearly say about pectineus, that is arises from the pectin tubercle of pubic bone and attached to the pectinal ridges or pectinal line, which is present at the posterior surface of the shaft of the femur. And here it is the adductor brevis. Look, brevis means short, longus means large, brevis means short. So this is a short muscle. This is a short muscle. This is a short muscle. This one. This is a short group of muscle. So adductor brevis, and this one is pectineus. This one is pectineus, and beneath the pectineus there is adductor magnus. We can if we cut the pectineus muscle, we can see about the adductor magnus. Okay, so let's go to another one. So this one is known as adductor longus. As I say, longus means long group of muscle. This one is adductor longus. All are arises from the ischial tuberosity of hip bone. So another muscle is known as most medially here. As I highlight it, I highlight it, this group of muscle, this muscle. This muscle is known as gracilis, which is attached to the medial surface of the upper aspect of the tibia, beside the sartorius muscle, as I previously said. Here you see, as I mentioned, if we cut the pectineus muscle, there is this one is adductor magnus. This one is adductor magnus. Okay, so next go to, there is some sort of vessels. There is some sort of vessel that is known as adductor canal. This is adductor canal or adductor hiatus. Adductor canal, it passes, here I mentioned, it passes the saphenous nerve, which is a continuation of femoral nerve, and it is always a question in Neet PG, that is in adductor hiatus or adductor canal, the passage of which nerve? That is the common answer student will give, that is femoral nerve. No, that is saphenous nerve. There is saphenous nerve and the femoral artery and femoral vein. So after crossing the adductor hiatus or adductor canal or Hunter's canal, that the femoral artery becomes the popliteal artery. Okay, which I have given various branches, that is 5 branches, and superior inferior genicular branch and the continuation of the popliteal artery. Okay, so this one is the cut muscle. The cut muscle is known as anterior compartment, as we clearly read before slide, that is the rectus femoris. Okay, so this group of muscle is, as I clearly said after, that one is adductor longus, and this one is to the behind, that is hamstring group of muscle. Hamstring group. There is 4 group, that is bicep femoris. I write in short form, that is bicep femoris, and the adductor magnus, semitendinosus, and the semimembranous. Okay, so it is all about, and these group of muscle, these 3 group of muscle, that is, here one is, as I say, gracilis, sartorius, and semitendinosus. Okay, the posterior segment will be studied in next video. Okay, so we can clearly summarize this thing that here it is obturator externus muscle. First one is obturator externus muscle, which is arises from the external surface of the obturator foramen, and there is another muscle that is known as adductor magnus. As I said, adductor magnus has two head. So the another head and the another head is from the hamstring group of muscle, and the other group is from the medial compartment of thigh. So it is present behind the adductor magnus is present behind the pectineus muscle. If we cut the pectineus muscle, as I here mentioned, if we cut the pectineus muscle, we can clearly see about the adductor magnus. Okay, there is adductor brevis muscle and adductor longus. Brevis means short and longus means long, and there is gracilis. There is gracilis which is attached to the which is arises from the ischial tuberosity and attached to the upper part of medial surface of tibia, and here it is three tendon, so which is attached at the medial surface of the tibia, that is gracilis, sartorius and semitendinosus. And there is hamstring group of muscle, as I mentioned, hamstring group of muscle, that is adductor magnus, semitendinosus, semimembranosus, and bicep femoris. And if we clearly mention about the nerve supply, so this could be the nerve supply, that the obturator externus muscle, that is the obturator externus muscle, which is supplied by obturator nerve and function as lateral rotator of thigh. Okay, so the as I mentioned about the adductor magnus forms the hamstring group of muscle, and the hamstring group of muscle mainly flexes hamstring group mainly flexes the thigh, and supplied by sciatic nerve. Here it is a point that sciatic nerve is the largest and thickest branch of sacral plexus. The mnemonics is S for S. The femoral nerve is a longest branch of lumbar plexus, and the sciatic nerve is largest and thickest branch of sacral plexus. Okay, so and in this group of adductor magnus and adductor brevis and adductor longus, as you read that all are a powerful adductor, which is adduct the thigh, and the hamstring group of muscle flexes the thigh, and the pectineus muscle is adduct and flexes the thigh. And the gracilis and the gracilis, as I mentioned, a duct. Overally, the medial compartment of muscle of thigh that is mainly form the adductor, mainly form as adductor, that is obturator externus, gracilis, adductor magnus, adductor longus, and adductor brevis. Okay, the sartorius is mainly flexes the thigh, and all are adduct the thigh. Okay, so next video we can go to the posterior segment, that is the gluteal region, and there I can mention about the gluteus maximus, gluteus minimus, gluteus medius, and their nerve supply and their function. That is most important and always asked in post graduation examination. So here, so thank you for watching my video. So please subscribe if you don't, and don't forget to share. Okay, thank you.